Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit. Dr. Schwartz is taking some much-deserved time off this week. Today marks 1 year since Connecticut declared coronavirus a public health emergency. It has certainly been a year we could have never predicted, but also one that has shown how resilient we all are. JP, as you reflect back, what are your thoughts and takeaways from this experience?
Sandy, the past year, as I've said a few times before, has been the most stressful time in my 30 years with Masonicare, but also the proudest. And when we think about this past year, our task force was established. We had our first COVID cases about 2 weeks from today that we would have had our first COVID cases. And that really started some amazing work with our staff. And when I think about it, some of the things to really reflect on are things such as working from home. When we did our work from home, I will tell you that 2 years earlier, we were actually talking about working from home, sending departments home. And I will tell you the time it would take us from discussion to actually sending a department home was about 6 to 7 months. Fast forward, we have our first health emergency from the state of Connecticut. 4 days after that health emergency, we made the decision to send 100 of our staff to work from home. Think about that. The time it took originally to now doing this in essentially 4 days. The staff were amazing. They understood what they needed to do. We also, when the task force started, we restricted visitation. We said we will not have any visitation on our campus. I'm happy, actually today, we actually had in-person visitation. And if you think about that, it's been about a year for some of our residents who have not seen their loved ones in person. It breaks my heart to some extent that we couldn't necessarily do it, but we did it because we knew it was the right decision from day one to protect our residents. And if you think about it, we just had our face-to-face visits. However, we have been doing video conferences, and we've actually had about 14,000 of them this year in our nursing home. And we actually had 7,000 facilitated or window visits in the same time frame. So think about that. 21,000 either virtual visits or window visits or outside visits. 21,000 in this 1 year. It's truly amazing that our staff were able to do that. And for our employees, they've done an absolutely amazing job at doing this. We also, when we started 1 year ago, we had about 1,800 surgical masks. We've used about 300,000 of them. We actually have over half a million surgical masks sitting in stock right now. Truly amazing. 1,800, use 300,000, and have 500,000 sitting in storage. It's truly amazing. My hat's off to the purchasing department for all that they did during this time. And if you think about it, just think about the PPE. We had times where our product that we had ordered and bought, were diverted to New York City during the height of their pandemic when it started in that area. Those were extremely challenging times. And again, our staff were able to work through those challenges. When I look at one of the first things that we also did was screening every single individual to come in to our campuses. And we have recorded over 250,000 screenings in all of our facilities since the start of this. Again, truly amazing. A lot of work, a lot of energy. a lot of time that was put into this. Fast forward, we started to do resident and employee testing. All of our nursing home and our assisted livings, we started doing testing, either on a once a week, or in some instances, we were doing twice a week. To date, we have done almost 48,000 tests, COVID tests on our residents and staff. Think about that, 48,000. We also, in December 21st, this day of hope, we've started to do vaccinations of our residents and staff. And again, to date, we've done 4,500 vaccinations through 63 clinics. Again, absolutely amazing. A lot of work, a lot of energy behind that. And our staff and our residents and our families have really shined during this time. Also, during this time, we cared for over 525 individuals who had COVID, whether it be in our home care company, whether it be in our nursing home, whether it be in our assisted living, whether it be in our independent living. We took care of 525 individuals. And at every turn, our staff did a fantastic job. From a cost perspective, we spent about $1.4 million just on PPE and COVID incentive payments for our staff, just in that 1 year. And one of the things that I find very interesting is the amount of meals that we had to deliver. So remember, before this, many of our campuses, our residents would sit down and they would be waited on. During this time, the majority of the time, we were actually delivering meals. In this past year, we've delivered almost 1 million meals to our residents' patients. Again, truly amazing. So when I look back, I can't tell you how proud I am of our staff. When you hear these stats and you look through them, it's mind-boggling that they were able to do what they were able to. A year ago, I would have never been able to tell you that we could accomplish this in 1 year, but we did. And I think that's the true resolve of Masonicare. We are Masonicare strong. We are 1 year stronger because of this. Was it easy? Absolutely not. Do I ever want to go through this again? No, I don't. But I can't tell you how proud I am. Today, sitting outside where the visitation was going to happen, I couldn't tell you how excited I was. That I knew families were going to be able to reconnect with their residents, able to do something that has not really been able to do for 1 year. It's not about Masonicare. It's about that connection that they have, that we get to witness. It is truly just inspirational. And Sandy, I would tell you, and I'd be remiss if I didn't, that this was probably, again, the toughest time that we went through, but there were so many great things. So one thing I wanted to bring up was the video. So I said we did 14,000 of them. And there's one that always sticks out to me, and that is a resident who was a very religious lady, wanted to have a virtual visit with her family. And she was. And one of the things that she would do is hold on to her rosary beads and pray. She couldn't find them. One of our staff noticed it, came in, found her rosary beads, and prayed with her on the video. That's what we're all about. That's what makes Masonicare strong. That's why we've been able to overcome this in this year. Is there more to come? Yes. Do we still need to continue to battle the COVID? Yes. But I can't tell you how proud I am of our residents, our staff, and our family members for being so supportive. It's been as difficult as it has been, it's also been a time of reflection, of very positive energy that has been able to push forward. So this year, I look back really as a group to say thank you. Thank you for everything that they've done. Again, I'm very proud of all of their accomplishments.
Beautiful words, JP, and indeed we are 1 year stronger together. Well, thank you so much for sharing your time and your reflections with us on this day. And we thank you, as always, for watching at home. Until we see you next time, we hope you'll stay safe and stay well.